Caring for a loved one with Alzheimer's or dementia at home? Whether you're a family caregiver or a home healthcare professional, this video gives you real-world strategies to manage common challenges with compassion, safety, and skill. It blends clinical insight with practical tips for daily care. Each section is built to remind caregivers that they are not alone. They are part of a care team, and that with the right tools, they can make each day safer, calmer, and more meaningful for their patients with Alzheimer's, dementia, and for themselves. Let's get started. Alzheimer's dementia is progressive, meaning symptoms worsen over time. Memory loss is just one part. It also affects judgment, behavior, and communication. Each person's experience is unique. Patience and flexibility are key. Communication tips. Speak slowly and clearly. Use simple words and short sentences. Make eye contact and approach calmly from the front. Ask one question at a time and give them time to respond. Avoid correcting or arguing. Instead, redirect gently. Use visual cues such as gestures pointing to reinforce meaning. Daily routine and structure. Stick to a consistent schedule for meals, hygiene, and rest. Familiar routines help reduce anxiety and confusion. Use a large clock, calendar, or visual schedule to help with orientation. Safety first. Lock away cleaning supplies, medications, and sharp objects. Install grab bars in bathrooms, remove trip hazards, use night lights in hallways and bathrooms. Consider wander alerts or door alarms if the patient is mobile. Nutrition and hydration. Offer finger foods if utensils are difficult to use. Encourage frequent small meals or snacks. Monitor for choking or difficulty swallowing. Offer water often, even if they don't ask. Use brightly colored cups with lids for ease and visibility. Add hydrating snacks, popsicles, jello, watermelon, soups. Keep drinks visible and within arm's reach. Serve one food at a time on plain colored plates. Avoid patterns. Encourage independence with hand-over-hand guidance. Sit and eat with them to create a calm social atmosphere. Malnutrition is a quiet risk in dementia care, and dehydration can lead to confusion, dizziness, or infection. Note if urine becomes dark or very little. Always report any undue findings to your nurse. Handling challenging behaviors. Behaviors like aggression, wandering, or repetition are not personal. Look for triggers such as pain, hunger, boredom, overstimulation. Stay calm, use reassurance. You can say, "You're safe, I'm here to help." Use distraction or change the environment if needed. Use pictures or objects such as toothbrush, cup, shoes to prompt action. Personal hygiene tips. Let the patient do as much as they can, even if it's slower. Use step-by-step instructions and praise cooperation. Respect modesty. Use towels to keep them covered during bathing. Managing incontinence with dignity. Keep a regular toileting schedule every 2 to 3 hours or after meals. Watch for nonverbal cues, fidgeting, pulling clothes, pacing. Use protective undergarments and keep spares nearby. Clean gently and apply barrier cream if needed. Never shame the person. Use calm, matter-of-fact language. Change soiled items right away to prevent skin breakdown. Report any rashes or broken skin to your nurse. Medications. Never skip or double the doses without the doctor's orders. Use a pill organizer or set alarms. Watch for side effects like drowsiness, falls, or behavior changes. Report concerns to the home health nurse or doctor. Know when to call the nurse. Sudden confusion, sleepiness increase, or other change in behavior. Refusing to eat or drink for more than 24 hours. Falls, trouble walking or injuries. Fever, chills, pain, or other signs of infection. Difficulty swallowing or choking. New skin issues, e.g. sores, redness. New or worsening incontinence. Call 911 first for life-threatening situations such as difficulty breathing. Take care of yourself. Caregiving is rewarding but can also be physically and emotionally draining at times. Ask for help. Take breaks. Use respite care when needed. Stay connected with support groups or social workers. Remember, you can't pour from an empty cup. Create a supportive environment. Keep the home clutter-free to reduce confusion and falls. Label doors, drawers, or rooms with words or pictures, e.g. bathroom. Use contrasting colors to help identify plates, chairs, or toilet seats. Reduce noise, turn off background TVs, loud music during conversation. Encourage meaningful activities. Provide simple, purposeful tasks like folding washcloths, sorting coins or buttons, looking at photo albums, painting or coloring, gardening in pots or watering plants. Engage in music therapy. Even in later stages, music often sparks joy and memory. Try era-specific playlists. Offer safe, tactile objects, e.g., soft fabrics, sensory balls. Keep activities short and adapt to their abilities. Success is more important than completion. Foster connection. Use reminiscence, talk about old photos, favorite foods, or past jobs. Share gentle touch if welcomed. A handhold or shoulder pat offers comfort. Stay at their level, sit, don't tower, and match their tone and pace. Even if they don't remember your name, they can feel your love and tone. Prevent escalation. If the patient is agitated, step back, lower your voice, and give space. Try redirection. Here are some great redirection phrases. Let's go sit by the window together. Can you help me fold these towels? Let's listen to your favorite song. Would you like some tea or juice? You're safe. I'm right here with you. Real-life care scenarios and scripts. Scenario 1. I want to go home, even when they're already home. Try, tell me about your home. Then, offer tea, sit with a photo album, or walk to another room. Why? They're often seeking a sense of comfort and familiarity, not a location. Scenario 2. Refusing a bath. Instead of saying, it's time for your shower, try, let's go get warm towels. I'll help you feel better and clean. Offer choices. Would you like to wash your face or hands first? Why? Resistance often comes from fear, cold, or modesty. Gentle tone and warmth helps. Scenario 3. Accusing a caregiver of stealing. Say, that must be upsetting. Let's look for it together. Store away valuables and use consistent routines. Why? Paranoia is common. Arguing increases fear. Reassurance calms. Simple tools that help. Whiteboard. Post the date, caregiver's name, meal plan, and activities. Memory box. Fill with safe personal items for engagement and comfort. Music speaker. Play calming or nostalgic music to soothe mood. Simple puzzles or sorting trays. Encourage focus and fine motor activity. Color-coded labels. Identify drawers, rooms, or daily supplies visually. Pill organizer plus timer. Ensure meds are taken on time without guesswork. Plan for the future. As dementia progresses, needs will change. Work with the Home Health Agency and MD to update advanced directives, DNR orders, if applicable, and long-term care options. Discuss respite care or hospice support when appropriate. Use sensory cues for comfort and orientation. Smell. Familiar scents such as lavender, coffee, or cinnamon can be calming. Touch. Soft blankets, textured pillows, or warm washcloths may reduce agitation. Sound. Nature sounds, soft music, or white noise can soothe or improve sleep. Sight. Natural lighting helps with time orientation. Open blinds during the day. Taste. Offer familiar and enjoyable foods while monitoring for choking or swallowing issues. Tip. Some clients benefit from fidget blankets, aromatherapy diffusers, or music playlists from their youth. Emotional regulation. For both patient and caregiver, validate feelings even if the story isn't true. Respond to the emotion, not the logic. Example. I need to pick up my child. You can say, you must be worried. Tell me about them. Practice deep breathing or grounding techniques with the patient if anxiety rises. If you feel yourself becoming overwhelmed, pause, breathe, and step away briefly if safe. Sometimes redirection is less about words and more about changing the energy in the room. Be culturally and spiritually respectful. Include faith traditions, prayer routines, or spiritual music if comforting to the patient. Respect language preferences, cultural food customs, modesty needs, and household norms. Ask family about culturally meaningful activities, e.g., tea ceremony, religious readings, music. Spotting hidden symptoms of decline, weight loss despite eating okay. Check if they're actually chewing and swallowing. New repetitive behaviors could signal boredom, pain, or confusion. Increased falls or unsteadiness may mean meds need adjustment or decline is progressing. Night wandering. Watch for early signs of sundowning, confusion in late afternoon or evening. Report anything unusual to the home health nurse. therapist or MD immediately. Sundowning quick tips happens late afternoon or evening. Keep lights on, close blinds. Provide calm, quiet activity. Avoid caffeine or overstimulation. Use a reassuring tone. You can say, "You're safe. Everything's okay." Track behaviors to spot patterns. Keep a simple daily log of what happened before, during, and after challenging behaviors. Time of day. Agitation often increases late afternoon. What calmed or escalated the situation? Changes in food, sleep, bowel habits, or medication. Use this to help the home health nurse adjust care plans or notify the physician of patterns. Promote restful sleep. Stick to a regular bedtime routine. Bath, soft music, dim lights. Avoid stimulants, caffeine, chocolate, news, screen time. Afternoon, limit long daytime naps. Offer a light snack before bed. Use a nightlight and keep commonly needed items within reach. Talk to the nurse if nighttime wandering or agitation increases. Supporting late-stage or end-of-life dementia care. As dementia progresses, the patient may speak less, eat less, or sleep more. Comfort becomes the top priority. Gentle touch, quiet presence, and soothing tone matter more than words. Watch for signs of pain, grimacing, moaning, restlessness. Use soft foods or thickened liquids as needed. Communicate closely with the nurse about skin breakdown, breathing changes, swallowing issues. Ask about hospice care when symptoms become more complex or distressing. Prevent caregiver burnout. Signs you're burning out. You're always tired or irritable. You feel numb, anxious, or hopeless. You stop caring for yourself. You feel like no one understands. What to do? Schedule breaks. Even 10 minutes helps. Accept help from others. They might just need to be asked. Join a caregiver support group. Say yes to respite care or adult day programs. Talk with a counselor, social worker, or spiritual leader. Set boundaries. Saying no is not selfish. You can't pour from an empty cup. Refill yours often. Building emotional resilience as a caregiver. Reflect weekly. What went well this week? What was hard? Practice micro self-care. Stretch for 2 minutes. Drink a glass of water. Step outside and breathe deeply. Reconnect with joy. Listen to your favorite song. Text a friend. Laugh. You can watch funny videos on YouTube. Build a care team. Don't do it alone. Identify trusted family, friends, neighbors, or church members who can help. Join a local or online caregiver support group. Alzheimer's Association offers free ones. Schedule your own health checkups and breaks. Coordinate care with your home health team by communicating changes to the agency supervisor and other immediate staff involved in the care of your patients, such as the nurse and therapist. Your home health agency can teach hands-on skills, safe transfers, bathing with dignity. Evaluate home safety and fall risks. Coordinate therapy or behavioral support. Monitor medications and medical stability. Provide social worker support for family guidance or respite planning. Take notes or keep a daily log to share updates with the care team. Ethical caregiving practices. Always respect the person's dignity, even if they seem unaware. Maintain privacy and modesty during hygiene care. Seek informed consent to the best of their understanding. Report any signs of abuse or neglect to the nurse or agency immediately. Document clearly and honestly if you're part of the official care plan. Key reminders. It's the disease, not the person. Meet them where they are, not where you wish they were. Go slow. It's okay to take time. You're doing meaningful, life-changing work, even if they can't say thank you. Final thought, lead with empathy, not perfection. They may forget what you said, but they will never forget how you made them feel. Progress in dementia care is measured in moments, not milestones. Some days are hard. That doesn't mean you're doing it wrong. Remember, you are their calm when they are lost. You are their advocate when they cannot speak. You are the constant in their ever-changing world. Thanks for watching. For more videos like this, be sure to subscribe. If this video was helpful, hit the like button. It helps others find it too. If you're looking for helpful, downloadable digital resources on home health management, visit my Etsy shop, link provided below. For questions and insights, drop a comment, and if you know someone who could benefit from this video, feel free to share. See you in the next one.